UK Prime Minister Boris Johnson has said a second wave of coronavirus is on its way. It comes as the World Health Organization warns countries in the Northern Hemisphere they must prepare for a winter battle against the disease. The Trump administration has issued new rules aimed at banning the Chinese-owned TikTok and WeChat from the US app stores. The restrictions will ban the transfer of funds or processing of payments through WeChat from Sunday. The barrister Amal Clooney has said she is resigning as the UK's Special Envoy on Media Freedom. Her decision is over what she describes as the government's lamentable decision to violate international law over Brexit. Well, let's return to the latest on the coronavirus here in the UK. The latest government figures show the highest daily number of new infections since the latest surge began, with 4,322 new cases in the latest 24-hour period. That means the average number of new cases reported per day in the last week is 3,466. And as new cases have climbed, so have daily hospital admissions. The weekly average for new admissions is 221. Note that Scottish data is only published up until September the 7th. 27 deaths were reported of people who died within 28 days of a positive COVID-19 test. And that means, on average, in the last week, 17 deaths were announced every day, taking the total number across the UK to 41,732. Well, there are now more than 1,000 people in hospital with coronavirus, and there are continuing reports of serious problems in the testing system. Here's our health editor, Hugh Pym.
There are yet more stories of delays and frustration at virus testing sites. Traffic came to a standstill in South London as people who'd booked tests waited to get to the location they'd been told to go to. But at the site there was no testing, just officials saying the bookings hadn't been registered and people should leave and try again. Leah has symptoms and was driven down by her husband to get a test, enduring the heavy traffic, but not getting what she needed.
It was very upsetting, to be honest, because we were desperate to get a test. And we'd tried for so long, only to be turned away. And it takes so long to go through the process. I've also I've lost the will to do it.
Other testing sites were open, but most were fully booked. Demand for tests has surged, partly because of an increase in coronavirus symptoms and cases. One guide to what's happening comes in a random survey of people in the community by the Office for National Statistics. It picks up those who don't realise they have the virus. In its most recent week, the survey shows that nearly 60,000 people in England were infected. Now, that's a lot fewer than in May, but the previous week it was fewer than 40,000. That means 1 in 900 of the population in England were infected, with the highest rates in the northwest and London. In Wales, by comparison, it was 1 in 2,000. The survey doesn't cover the rest of the UK. Health officials are concerned that the numbers seriously ill in hospital with the virus are now rising, a delayed reaction to the spread in the community. Admissions of patients to hospitals, some needing intensive care, have doubled in about a week across England.
We are at a point where we are now seeing critical changes in the number of infections in hospitals. We're seeing a rise that's slower than happened in March, but nonetheless, if it continues to rise in the same way, we would expect to see similar numbers that we had in hospital at the end of March in about 3 to 4 weeks' time.
So the big question now is how much faster the virus will spread in communities and how many will need hospital treatment.
How much, for how long? Of course, this is anybody's guess, but it's also not inevitable that how steep the curve up is going to be. So the UK can write its own history. And so it's very important that as fast as possible, as effectively as possible, we put measures in place.
Whatever those measures are, ensuring that the testing system is working properly to track the virus seems as critical as ever.
Now, the Prime Minister has said we are now seeing a second wave of coronavirus infections coming to the UK. The R number, which represents the number of people an infected person will pass the virus to, has risen to between 1.1 and 1.4, meaning cases could rise very quickly. He spoke to reporters earlier.
Obviously, we're looking very carefully at the spread of the pandemic as it evolves over the last few days. And there's no question, as I've said for several weeks now, that we could expect, and we are now seeing a second wave coming in. We've seen it in France, we've seen it in Spain, across Europe. It's been absolutely, I'm afraid, inevitable that we would see it in this country. So Monday we brought in the measures that we did, the rule of six, to try to restrict what people are doing and to bring in a new buffer and just make that absolutely clear. The rule of six indoors maximum, 6 outdoors maximum. But the crucial thing is at the same time to observe the basic rules on social distancing, hands, face, space. That's what everybody's got to do if we're going to continue to beat this thing. But as we look at this particular curve and what's happening now, clearly we were going to keep everything under review. But the way, I don't want to go into a second national lockdown at all. The last thing anybody wants. I don't want to go into bigger lockdown measures at all. We want to keep schools open, and it's fantastic that schools have gone back in the way that they have. We want to keep the economy open as far as we possibly can. We want to keep businesses going. But the only way we can do that is obviously if people follow the guidance. And on your point, Sam, about consulting and taking people with us, the devolved administrations, the opposition, MPs, of course, if and when we have to go forward with other local, national measures or whatever, we'll of course be explaining very clearly to everybody how we see it.
Well, the Mayor of London, Sadiq Khan, said it is increasingly likely lockdown restrictions will be required in London. Mr Khan, who held an emergency meeting with public health experts today to discuss the next steps, said he is extremely concerned by the accelerating speed at which COVID-19 is now spreading in London. And he added that they are considering imposing some of the measures which have already been imposed in other parts of the UK. Right, let's go to Westminster. Our chief political correspondent, Vicky Young, is there. Hi, Vicky. So what do you make of the Prime Minister Boris Johnson's warnings and language there?
Well, I think the fact that he is saying that a second wave is coming feels like a significant moment. I think everyone over the summer was hoping that, although the fears were that, of course, the winter might be harder, I don't think people thought that by the middle of September we might be in this position where, as we've seen, huge swathes of the country, millions of people are under added restrictions. And then Sadiq Khan there, the mayor, suggesting that 10 million more in London might soon face similar things. Now, Boris Johnson very keen to say he does not want to return to a national lockdown. That is, of course, partly he says that it would be a total disaster for the economy, of course. This real desire to keep as much of business and the economy open to try and save people's jobs. But of course, they have to weigh that up, as they have done all the way through, the impact on the economy with saving people's lives. And that's why you've seen there these measures done locally up to now, but getting to the point eventually where there will be so many people under these restrictions that actually does feel like national measures. And clearly, I think the plan in Downing Street being talked about, not signed off, of course, but various ideas knocking around, really. One of them for this circuit break, if you like, as sort of shorter few weeks of restrictions being brought in for everybody. That could mean households not being able to mix. But crucially, the plan and the aim is to keep schools open and to keep offices open as far as possible, but really to try and massively slow down the transmission of the virus.
So, Vicky, what do you think is coming this winter, and what do you think the options are for the government to try and deal with it?
Well, I think, the mood is pretty concerned in Downing Street. Ministers see this data coming in all the time. Of course, at least they do have more data than they did last time, despite the problems with the testing system. They certainly know more about it. They know more about how it is transmitting, and households being the key way that is happening, and hospitality, rather, they say, than in the office environment, for example. Now, the Biosecurity Committee met. That involves lots of senior officials, medics, and chaired by Matt Hancock, the Health Secretary. Now, they're talking about the possibility of a tiered system. So you have tier 1, 2 and 3, and tier 2 would mean these bigger restrictions being brought in really nationally. So curfews we've seen in some places, hospitality, some of them closing or having their hours restricted, and that idea that you don't mix with households. So the question is whether that gets adopted. And then there's a big question, of course, again, about the most vulnerable. How do you protect them? Last time it was shielding. They are very aware that that's a very draconian measure, very, very difficult for people to not even be allowed out. And of course, very mindful of the fact that at the moment, no sign of a vaccine ready to go. That might not come until next spring. So some of these measures could be in place for months to come.
OK, thanks, Vicky. Vicky Young now. And just want to bring you some breaking news from the Netherlands on, well, a very similar, familiar theme now. The Dutch are introducing new measures, new restrictions, essentially, to 6 regions there. That's as the infection rate increasing, approaching 2,000 a day there in the Netherlands. Some of the restrictions to areas like Amsterdam, Rotterdam, The Hague. Cafes, restaurants, bars must close at midnight. Everyone must leave by 1 a.m. Maximum 50 guests, and gatherings of more than 50 people, such as concerts in a park, must be registered with local authorities.